Hmm. Hey, Bo. Hey, Bo.
Hi,
Oh, you can hear me good, good. How you feeling?
I'm good. How are you, darling?
I'm good. I'm good. I was sitting in there and I was like, you know what? It's nice out. I can go outside and sit outside and do this.
Exactly. I agree.
That's a two for one. How y'all doing out
Exactly.
there?
Good. Can't
Okay.
complain. Trying to get ready for Tuesday. So,
What's Tuesday?
Ken starts back school.
You just said
Yes, yes. Hey, Sean.
Hi, Tyra.
Hey, that's Sonia. Hey, guys.
Can you hear me?
I can hear you very well.
Okay.
I can hear you very well.
I'm doing my eyelashes, so I'm gonna put it on mute. But I'm here.
Absolutely. And I see, I saw that brief moment. So you're getting cute. Ain't nothing wrong with it.
I got a picture on Wednesday.
Hey, yeah, these are facts. You're off Monday, so you know.
I'm off this. Am
Yeah,
I
the
off
office.
this?
Yeah, the office will be closed on Monday for the holiday.
Oh, I didn't know that.
Yeah, neither did I till about an hour ago.
Ah, okay. Then yay. So I'll be there Wednesday, definitely.
Absolutely. Yeah, so that gives you a day to enjoy yourself.
Thank you.
Yeah, absolutely. Hi, Quita.
Hi,
How are you?
I'm good. How are you?
Good. You look lovely.
Thank you.
Oh, nice. How's everything going today?
Everything is going wonderful. How's your day going?
Good, good. I was just telling Janelle that I was inside. I just, finished like my work day on site, in the city, et cetera. And so then now home and it's like, okay, get settled, get situated. And I was sitting inside and I set myself up and I was looking out the window and I'm like, it's nice out. I'm like, you know what? Go sit outside and do this.
Yes, yes.
Here, make it a two for one. The sun is good, but I changed my position because of the glare. But
Yeah,
you know what? No, this right here is perfect. I can still feel the air. I can still feel the radiation from the sun. So this feels good.
absolutely. I don't blame you. Well,
Yeah, it feels amazing. So now I'm actually just taking a moment to relax, and it's coming in on the cusp with you guys.
yes. Come on now.
House husband and baby and everybody on your team.
Everyone is good. Everyone is good. We actually got company over, family over.
Okay.
So hubby is entertaining, and
Okay.
so doing what we do, multitasking.
Okay, very good. What you got good to eat?
He put simple stuff: brats, Thai sausage, rib tips,
Nice.
hamburgers, chicken.
Okay. That's a meal. That's a meal.
Yes.
That's a meal. That's a meal. Good. We're going to give Ladaya a couple more minutes to come on. My thoughts on this, and every time I do a Zoom, is always, especially because it's a platform, we give it time, or whatever. We want to do that, but we want to continue to move forward and do what we have to do. And that's regardless of who we have and who we don't have.
Absolutely.
Because as people jump in, they jump in, and wherever we are, they can jump in at that point. So I'm 100% like always okay with that. But what I never want to do is like hold time waiting for people.
Mm-hmm.
What we know is that time don't wait for no man.
Absolutely.
So we'll give her a few minutes to join us, and then whenever she joins in, wherever we are, we'll let her jump in. We'll give, about 5 more minutes just generally for people, whomever, and then we'll go ahead and start. I'll just welcome him out, do the welcome, and then, and let you guys, it's always best to tell your own story, so I'll introduce you guys just by name, and let you guys go ahead. You can introduce yourselves, and then you all can share what you have prepared to share, the information that you all think is important, information that you think is, gonna be good for the people, for right now, for the months to come, because what we're gonna do, of course, is recording. So in this, then what'll happen is we will still share the recording. So that's why we move forward, because we're gonna record it, we'll share it, and so whom forever can't join us because it is Labor Day weekend. I didn't even think about that.
Mm-hmm.
I didn't even think about the fact it was Labor Day weekend until like maybe yesterday, I got reminded. So it's really one of those things. I understand people are probably out about, and so we just want to make sure we do what we were called to do here, do our job, and then we're gonna have the information saved. We'll put it out there so people can get to it. Those that join us, we welcome them, and then we're gonna move through and handle our business. And so I look forward to seeing, to hearing what you guys have to share. So this is really it's our platform, but it's your platform. So you guys can do with it what you will. I know that you all are more than capable and competent. And I love you guys, and I appreciate you all for taking the time to just share and come and be here so that you can facilitate being a help, to the community. Because this thing, just period, wellness. And I know, Quita, you're a huge wellness advocate. Yes. And that is now one of your big things. And so even when we talked some months ago and you were saying, that you had some ideas, and definitely we want to continue forward and move, with that, to continue to let those ideas come out, and really manifest themselves. Because I believe wellness is huge.
Absolutely.
Before death, there's wellness.
Yes.
Minimize death. And in order to help us in that way, then we definitely, wellness is where it is. You got to be proactive, not reactive. Absolutely. And I think even with healthcare, things move to a preventative model. It wasn't any longer about just treating things when they come, but over the last decade, it's about prevention for sure. What can we do to help prevent things? And so I think this wellness platform that we have for the community, and having you all not just as a part of our board, but as a part of our community, as nurses that are serving, and just as women that are passionate about helping people, to have you all to be here and to share so that we can get the message out to the masses from us, reliable sources, reliable people, to be able to help do what we can to minimize things.
Absolutely.
Yeah, so I'm excited. I'm excited about this, and look forward to how we'll be able to continue to facilitate this in the future. And even, of course, when we can, to meet in person, and do things in person too.
Yes.
Yeah. Tamika.
Hey, ladies.
Hey, Tamika.
Hi, Tamika.
How's everybody doing?
Good. How are you?
Good.
Great. Thanks for taking your time out today. We appreciate it.
No problem. No problem.
Looking good. We're waiting. We were giving Ladaya a couple more minutes to join. And I was just thanking them, for being here and just kind of letting them know how we're going to take the direction with this. We'll start at 5:10. That's about 2 more minutes,
Okay.
which is that we're going to introduce the ladies. But I mean, just by name, we'll let them introduce themselves, and then they can, go from there and share with us what they want, what they need to share with us, what they prepared, things that they think we need to know, where we are. Quita, she's general wellness as well, so she wants to help, with the holistic component of things, period. And we want all of that, so we'll let the ladies take it from there.
Okay.
When LaDaya joins us, if she's not on at that point, whenever she does join, then whatever she has to share, then she can. As people join in, they can share or ask questions or take it all in. We're recording, so then we'll record and do our part so that we can also then just put the information out there and share it with the public after.
Great. Sounds great.
Okie doke. So we got another minute, ladies. We just said they over there barbecuing and boogalooing.
Look, not boogalooing, but
It's a beautiful thing.
yes,
It's a
it is.
beautiful thing.
Nothing wrong with boogalooing, Quita.
Look, I know that.
Where's Janelle?
She's here.
I'm here.
Hey, cuz, how are you?
Hey, babe, how are you?
Good, good.
All right, ladies. So we're going to go ahead and roll with it. I just want to say good afternoon to everyone. Happy Labor Day weekend. Again, please move around safely, whatever you all are doing. This is Southwest Funeral Home and Cremation. We are joining in today so that we can go over as a community wellness topics relative to things that you all need to know going into this fall season and winter season. We all see it even on this weekend's news. They're speaking of how they're expecting spikes in the traveling season because this is the last holiday of the summer. And even though we have not had much of a summer with the restrictions, it's coming to an end. And with people realizing that, this weekend, they're trying to maybe get out and do things because they know that you can expect the unexpected. Everyone knows that the news is out there, and whether they say it publicly or whether they're just thinking it, they have concerns about what they're hearing and what we know to be true, which is that we can expect one heck of a winter. And so I just feel like as a death care provider, and as a community service provider, it's our responsibility within the community to do what we can to be proactive, to give people the tools that they need, to be resourceful, and then to let them take those tools and then utilize them. And with this being in the middle of a pandemic, and just generally considering how, in fact, infection does spread generally, to make people the wiser, and then just to generally address the concerns, dispel myths, so what's not true, to give the information to them and let them go ahead and digest that so that they can make sure that they're taking care of themselves first off, so that they can continue to take care of their families and their homes and do their due diligence. So this is important to me because I know that people are hurting. I know people are concerned. I know people are scared, but moreover, I also know that people can do better. And so I want to make sure that we're equipping people to help them do better and in love, from a place of love and from a place of genuine concern. So I thank you all for being here. I thank you all at whatever point that you do hear this message and this session, this event, and it comes to your ears. I do hope that it is beneficial to you. Please take everything away from this that you can and then share it. Okay, so today we have two special guests with us. Two of our three special guests are here. We do not want to prolong the time. As we know, it is Labor Day weekend and people want to go about whatever their business is. So two of our three are here. We're going to go ahead and get started with them. We have two amazing women with us. I've known both of them for a very long time. I trust them. I can talk to them, not only as a friend, but as a professional, even as a healthcare provider myself, as a mentor to me whenever I need it, advice or to talk about things that are health related. These women are amazing. And I've watched them even excel in their own collegiate careers as nurses, as well as their profession as nurses. When I say they love people, they do. And so we really are honored to not only have them on our advisory board available to us to be able to help the people of Chicago and those who do join us, but we are just excited and amazed that they think that what we do is worth attaching themselves to. So we have Dr. Jonelle Benson Cobbs here with us today, owner of Serenity and care facility in Linwood. She's going to be taking the platform. And then we also have nurse practitioner Lady Quita Stokes. And she also is pursuing not just her advancement as a nurse, generally about how you can do better. But this is their story and they can tell it better than I can. So I'm gonna pass the floor to them. Whichever one of you ladies would like to start first, feel free. And again, Quita, would you like to start?
You're breaking up. You're breaking up a little bit. Can you hear me?
Okay, I'm sorry. Quita, would you like to start?
I'll start, no problem. And what would you like to know?
I can hear you.
You can hear me?
Okay.
Hi, guys.
Well, go for it. What do you
Hello.
Hello.
Who do we have joining us?
Who do we have joining us?
That's me.
Oh,
With the years. Okay.
Echo. You need to close out one of your windows, Tyra.
Mm-hmm.
okay. Yeah, when you said when I could tell the phone was breaking, I just wanted to go ahead and switch gears and add another modality. But yeah, Quita, if you could just, go ahead and let us know what you're seeing generally, what your platform is, things that you think are beneficial for people generally at this point to know. What do you think is most critical right now? Not just with regards to COVID and protecting themselves, but just generally, what can people do at this point? What's going on from a professional standpoint? What are you seeing?
Okay. Hi, guys. As Tyra said, my name is Quita Wiley Stokes. I am a nurse practitioner, a new nurse practitioner. Been a nurse over 17 years. And I'm just excited about health in general. There's a lot of things that's going on in our society right now. A lot of people are nervous. A lot of people are scared. There's been a lot of devastation that has taken place related to the pandemic with COVID-19. So as a provider now, I am able to see both sides of the arena. And what's most important, like Tyra said, when I went into medicine, one of my reasons for going was I wanted to practice medicine on a holistic realm and arena. And another thing is education. Because what I find is a lot of our minorities are not educated on the disease processes. There's a lot of myths. There's a lot of myths that's going around about the pandemic, and a lot of things that are not true. And pretty much one of the things that I see is a lot of people that are being exposed to this pandemic are people that are not generally healthy. Okay. And one of the things so the statistics that we see from the CDC standpoint is most of the people that catch the coronavirus, they have some type of underlying disease. And you usually get people to be like, oh no, I'm healthy, I'm healthy, I'm healthy. Because you think you're healthy and you're not going to the doctor, you've never been diagnosed with something, that does not mean that you're healthy, okay? And that's what we're finding. I just use myself as an example. 2 years ago, I was diagnosed with lupus. And as an African-American woman and with statistics, you know that lupus can lay dormant for many, many years. Okay, so you might not know that you have lupus or any autoimmune disease. So guess what? If this pandemic had hit a person that was in that phase that had never been tested, did not know that they had autoimmune disease, they have not gotten treatment or anything like that, guess what? The coronavirus is going to affect them, right? They're going to get sick. And then all of a sudden the family, everyone's like, oh no, she was absolutely healthy. She had no ailments. Nothing was going on with her. When overall she really did, or he really did have an underlying disease. And that was the reason why he was unable, or she was unable to fight off the disease process. So the main goal, so what I do now is, in my arena of practice is I practice holistic health, and I educate on building your immunity and building yourself through health. Health is wealth, and people need to understand that health is wealth. So if you're taking care of yourself the way you're supposed to be taking care of yourself, getting your checkups, getting your labs done, doing those type of things on a daily basis, communicating with your providers. When something is going on with you, call out to your providers and let them know what's going on. A lot of the times we want to practice holistic, we want to practice home remedies and get rid of them, when most of the time these are disease processes that are manifesting very early on. So the best thing that you could do is communicate at this point, because that's huge. And then that way, you can, possibly have a chance. As you can see, a lot of things are trending and are different. Even though a lot of people are still being exposed to the pandemic and to the coronavirus, there have been a lot less deaths, okay? Because a lot of people are building their immunity to the disease process. So, and that's what we really want to see. Honestly, it's no different than rubella. It's no different than the swine flu, the measles, the mumps. You're going to have to go through this process until we get to where we need to be. So my advice to society at this point is just educating yourself, doing what you're supposed to do to protect yourself, and educating others as well, and doing what you need to do to take care of your body. Drink and stand hydrated, taking your vitamins, holistic vitamins. We're not talking about the vitamins with the fillers in them and things like that that you could just get over the counter. We're talking about holistic vitamins, taking in, steaming every day, steaming and different things like that, washing your hands, disinfecting. And then another big thing that is really huge right now is behavioral health. A lot of people are depressed. They're struggling. And when you're depressed and you're stressed, guess what happens? Your immunity goes down. So, just educating people on reaching out to the resources that they need to get the resources that they need, and education and taking care of themselves. So those are some of the things that I have seen. Those are some of the things that I've been educating on, and it seems to be working. You're on silent. You're on mute.
I had to make sure I didn't have you disrupted with any type of background noise. The dog is barking.
Okay.
Okay, when you say holistic vitamins, what types of vitamins would you recommend and where would people be able to get them from?
Holistic vitamins, I tell people all the time, I don't want to give any type of disclaimer on a certain type of vitamin.
Right.
So what I usually tell people is do your research. There's so many different good vitamins out here, so many different programs. What I noticed is people, they will spend money on any and everything, but they don't want to invest in their health. Okay. And vitamins, holistic vitamins cost. You have the Dr. Wallach regimen out here. You have Dr. Seabees, the TLC products. I'm just gonna put but they're okay. And the reason why I know they're the bomb is because prior to me starting products, I was sick, like really sick, and I was going through a lot. So they really helped me. But I did a lot of research, and I went through a few to find what worked for me. But I invested in myself.
Very important. What would you say are some things to avoid, maybe?
As far as
just generally, obviously, when we talk about this whole thing, we're talking about, of course, social distancing, wash your hands. Is there anything like food-wise that people should generally avoid that would make them more susceptible, or anything along that nature? I know stress obviously is a huge factor because it does weaken the immune system. I think sometimes people overlook that. And like you said, depression, and I talk a lot about a lot of different things. And that's one of the things that I do talk about because I understand that people, well, they're thinking and considering what's going on with them mentally. So, you're not paying attention to, even though the fact you're emotionally maybe not in your normal set point, mentally, so you're not in your normal set point, but your body then physically is going to follow that and not be at its normal set point. And it's easier said than done. Okay, I should and I shouldn't do this. People know they should take a walk. They know they should go out and, ride a bike if they can, or just get some air. So we got a lot of do's. Are there any don'ts?
The don'ts is, really my big thing that I tell people all the time, stop listening to everybody.
Yeah.
That's my biggest don't right now. Everyone had their own thought process about this pandemic and about what we're going through. Yeah. And the best way, if you did not get it from the CDC, I would not listen to it. Okay. I would not listen to it because this is ongoing statistics that is being ran on a daily basis by providers, by scientists, and they're bringing you raw results. Okay. So all I say is, stay alert, stay aware, but don't listen to Tina, Rob, and Tony about what they went through, because everybody system is different. Everybody is gonna react differently. I would just say continue to practice your social distancing, your hand washing. Just start taking better precautions. Like now, I keep sanitizer, hand wipes in my car, Kleenex, water, and things like that. So every time I get out, if I pump gas, I wipe my hands off. I, sanitize things before I get back in. I wear my mask when I'm in public, around a lot of people. Those type of things. Just paying attention. One of the things that I do want people to also think of as well, you have to think outside the box. Now everything is devoted. You got to cough. You got to sneeze, you got a fever. Oh, you got corona, okay? Everything is not corona. Everything is not corona, okay? There's so many different things, and I've been seeing it so much. A couple of times I've caught, that patients was being diagnosed with corona, and they really had influenza. And we're walking into influenza season. So use precautions and think outside the box as providers, because they even have the providers all over the place thinking like, okay, and then you got a person that came in with influenza, and that's treatable. That's treatable. So, you can die from influenza just like you can from corona.
Right.
So you want to make sure that you are practicing safely and doing what you need to do for your patients. So don't leave anything, crossed off your map. Nothing. You have to do everything. So everything is not corona. Think outside the box and make sure that you're treating your patients appropriately.
Okay. Janelle, Dr. Cobbs.
Yes, ma'am, I'm here.
Okay, so just kind of piggybacking off what Nurse Stokes said, thinking about going even into the winter season and the normal influenza season, what would be your thoughts and concerns or recommendations more so, and tips making the transition just in habits and kind of understanding that, yeah, we're expecting to have a difficult winter. I mean, like, what do you have? What do you think? What's your position based off of what you know and what you're seeing?
Yes, so I certainly agree with what Quita mentioned. The information that I will provide is more so what I see on a daily basis, obviously dealing with the high-risk population of individuals with substance use disorder. So I will address that moving into the 2021 flu season, as well as some of the different questions that I get on a daily basis from some of my clients. And just because I get them from mine doesn't mean that Quita or whomever don't hear these same questions or myths and things. So I'm just going to address some facts and things that people should be aware of as we move into flu season. One of the things I know as a provider, in conjunction with the coronavirus, because the flu season, as we know, will coincide. We're moving into the flu season, and it will coincide with this pandemic. We need to strategize. We need to find better ways to motivate ourselves, motivate our relatives, motivate our friends, our clients, our patients, to be able to make healthy choices and habits, if you will. Whether it's getting a flu shot or not, I know everyone may not agree with vaccinations, but again, even if you don't agree with getting vaccinated, you need to be able to make healthy choices to keep you healthy. And again, with high-risk population, communicating with other local clinics, as Quita mentioned, just communication in general, targeting social media outlets, encouraging these individuals to be aware, be cognizant of, information that's out there, and just educating yourself. CDC, she mentioned CDC, the flu vaccination, as we know it, as it is recommended by CDC, should be administered annually. And this is for anyone 6 months of age or older. This is the recommendation. This is not Jonelle's recommendations, not Quita's recommendation, it's the CDC recommendation. So I know she mentioned the CDC and, talking about statistics and facts and such. This is the flu vaccination is a recommendation for anyone 6 months or older, okay? It is possible to have the flu as well as the coronavirus. And this is what people need to understand, and this is what people need to know. You can have them at the same time. And because this is something that you need to be concerned about moving forward, and due to the possibility of having such co-infections, it is imperative for us to do everything possible to reduce any additional illnesses and preserving that scarce healthcare, those resources, if you will, that are available during this pandemic, because we know that there aren't a lot of resources that are available to us right now. There just isn't, everyone, we're all kind of stretching, we're reaching. And so because we know this, and because we know that there's a possibility that you could have both at the same time, we need to preserve those. With the flu vaccinations, knowing that the optimal time is September to October. And I want to stress that because people are scared, as Quita mentioned. So everybody, I'm gonna go get mine earlier. Any earlier can put patients at risk of reduced protection against the infection for flu season. So I want that to be very clear. September and October are the times that we should be vaccinated. And, you know, going to get it any earlier because you're scared of what could happen and what you may or may not be exposed to, it's going to reduce your protection against the infection later in the flu season. So, you know, however the flu viruses continue to circulate, these vaccinations, I've heard, you know, just kind of, you know, in communication, because I am in communication, they may be into the early 2021 year. So January even, so we say, okay, September, October, but we may even see that stretch or that time frame extended because of everything that's going on. So that, you know, I mean, people will be allowed. So, you know, your local pharmacies, your doctor's offices. I know a lot of doctor offices, I know before weren't doing in-person visits. Your Walgreens, CVS Pharmacy, they do flu vaccinations. What I tell my staff, I always urge and encourage my staff to make sure that they stay vaccinated. One of the things, because of the population that we deal with, we are required by the state to be vaccinated. All of my staff is required to be vaccinated. I am required to be vaccinated. If the state walks through my door today, they will ask for that, and I have to be able to provide them with the records. And this is not the case for everywhere, but for me, you know, because I know that it is required, I do urge my staff to get vaccinated. What I've done, and I know other facilities or other, you know, clinics, if you will, have done, because there's a lot. We have a lot to do. We all are busy. Find someone or designate someone within your staff to lead or monitor vaccinations and those efforts for vaccinations within your facility to ensure that everyone is healthy, everyone is, you know, they have the resources in place that they need, just in case. You just never know. You know, some people, it's just a matter of a lack of education, and they just don't know how to access certain resources that are available to them. Any concerns or addressing any concerns that your patients may have about the flu vaccination. Some don't believe in it. Just very simple. They just do not believe in it. Address those concerns with your patients or with your relative about any concerns that they may have leading into flu season, as well as also still dealing with the pandemic. Knowing that the seasonal flu, you know, it protects us against the influenza virus strains that researchers, and I heard Quita mention scientists, have said, have determined, let me say that, to be most common. So this isn't anything, again, that's made up. These are researchers, these are scientists that have, you know, determined that these strains, or these strains that are out there, you will be protected against them if you so choose to be vaccinated. One of the other myths that I hear quite often about, flu vaccinations do not cause the flu. They don't. They do not. I mean, they don't cause the flu. It's the truth. You know, when you go into your doctor's office, that's why they ask you, have you had any, you know, cold-like symptoms, flu-like, you know, or anything prior to. But if you have it or you're vaccinated and you come out and you sneeze one time, oh God, the flu shot gave me the flu. Okay, flu vaccinations do not cause the flu. What happens is that some mild side effects that people have exhibited, or these adverse effects have perpetuated this myth. It does not cause the flu. Okay, it does not. They are safe. Always make sure that you assess, obviously, any allergies. If you know, if your family member or someone that has an egg allergy, make sure he or she requests a vaccination without egg protein. You know, it's simple things like that that people just don't know. To think, oh, I have allergy to eggs, I can't get the flu shot. Well, yes, you can. You can request to have one that does not have egg protein. As Quita mentioned, continue to practice your social distancing. Be very vigilant with your hygiene practices. You know, increasing your hand washing, wearing your mask when you're in public, especially when you're in communal areas, close proximity, or around individuals that are at higher risk for infection. You know, our parents, they're, you know, older in age, you know, someone that may be at higher risk for infection. You need to be cognizant of that. And again, just stay up to date. CDC.gov is an excellent resource, excellent website. And they always have information and recommendations for COVID-19. You know, and just, you know, if you have just general questions, and again, addressing these facts, these myths, you know, before it was the chloroquine or the hydroxychloroquine, you know, which we know that that's used to treat malaria. It's used to treat lupus and rheumatoid arthritis. It's been under study for treatment of COVID-19, but there is no data that shows that this drug will reduce deaths or hospitalizations among COVID-19 patients. So we need to be very aware of that, you know, and folks saying, oh, I got some here, and you're taking it at your own risk, okay, because there is no data that supports that right now. So let the medication that the scientists have said that medication should be used for, let them continue to use that medication for that. Currently, right now, there's no data to support that medication should be used for COVID-19. I've had patients come in asking about, you know, wearing masks, and, you know, when they work out, they like to work out. That for me was, I most of you know, I do enjoy working out. And, you know, with the mask, one of the things they say, well, should I wear a mask? Because, you know, the gyms are saying X, Y, and Z. The reality, the true answer to that is you should not wear masks while exercising. Masks can reduce the ability to breathe comfortably. And so what happens is when you sweat, that sweat makes the mask become moist or damp or wet quickly. And what happens is that it becomes even more difficult for you to breathe. And when it becomes more difficult for you to breathe, and now this mask is wet, what happens? Microorganisms are now present on this mask, right? So then, you know, it's an important preventative measure during exercise, but the best option, the better option, I should say, is just distancing yourself. I think the recommendation was like 1 meter or so when you're working out, to avoid that, and also to help reduce any issues with breathing. Let me see some of the. I know I had a patient that came in. Well, on topic about the microorganisms. Because I had a patient, oh, I got, you know, this medication at home and antibiotics. COVID-19 is caused by a virus, not by a bacteria, okay? Saying that antibiotics do not work against viruses, okay? So whatever you have at home in your cabinet, be very careful about just taking it, because again, it's caused by a virus. It's not caused by a bacteria. So some people that become ill with COVID-19, what happens is that they'll say, well, I took antibiotics. That's because when they were ill with COVID-19, they may have developed a bacterial infection as a complication. And in that case, antibiotics were actually recommended by the healthcare provider. So again, antibiotics do not treat COVID-19, okay? They just do not, you know, it's just, it doesn't, it just doesn't work like that. So, you know, I mean, and again, there are a lot of myths, a lot of facts about COVID. You know, I've heard people spraying bleach and disinfectants into their nose, their nares, and you know, all of this nonsense. Spraying and introducing bleach or any disinfectant into your body is not going to protect you against COVID-19. It's actually very dangerous. It's toxic. It's poisonous. These are poisonous substances that you're ingesting that can cause, you know, some sort of internal irritation, and subsequently it can lead to other things, even death. So, you know, that is not anything, again, that's recommended. That's not anything that's suggested. You know, the whole thing about the 5G network, that was a big thing before that was causing COVID-19, 5G. Okay. Viruses cannot travel on a radio wave. Period. Exclamation point, however you want to do it. Viruses cannot travel on a radio wave. COVID-19 is spreading. If you look at where this pandemic has, or these different countries that it has affected, it's in a lot of countries, guess what, that don't even have a 5G network. So how can it spread by a 5G mobile network when it's in countries and have killed people in countries that don't even have access to 5G networks? So it's just, it's not true. It's spread through respiratory droplets, when someone coughs, when someone sneezes, when someone speaks. You can also, be infected by touching a contaminated surface, rubbing your eyes, your mouth, or your nose, but it is not spread by 5G network. That is just not true. I know some people want it to be true and believe that, but it's not. It's not. So, again, there are a lot of facts, a lot of myths, but education is key. Vaccines, against pneumonia, because I got that question as well. Well, I had my pneumonia vaccine, which we get every 5 years. Does that protect me against COVID? No, it is not.
I can see how someone will come with that.
Absolutely. And I've had clients ask me that, well, I know my vaccine, I just had a pneumonia vaccine. Does that protect me? No, it does not protect you against the COVID virus. Vaccines against pneumonia, like the pneumococcal vaccine, or even the influenza type B vaccine, what's happening, and that's what it was. They said they had the influenza type B vaccine. I think that's how it was presented. But my best rationale to them was, it does not provide protection against the new coronavirus. This is something new. We don't know how to treat this. We don't have anything to treat this right now. It is so new, it is so different that it needs its own vaccine, which is why they're out there and they're trying to produce a vaccine, hopefully very soon. So these researchers are out there trying to develop a vaccination against COVID-19. And then we have, WHO, the World Health Organization, they're supporting these efforts because it's that new that they do not know how to treat it. So no previous vaccination that you have had, whether it was for influenza type B, whether it was for pneumonia, is going to protect you against the new coronavirus. It's just not going to happen. Again, your best thing, or your options at this point, as Quita mentioned, social distancing, proper hand washing, and just knowing, again, that right now, currently, there are no medications that can prevent or treat COVID-19. There's no specific medications. Those that have been infected should receive proper care. You should make sure that you're reaching out to your healthcare provider if you exhibit any of these symptoms. Those that have severe illness or severe symptoms, they need that supportive care, and they need that supportive care ASAP. So, don't ignore the symptoms. I don't care how healthy you are, how healthy you think you are. If those symptoms present, you need to seek, some assistance from your provider. So that's about all I have.
Let me ask a question, ladies, then. For someone that has never had a flu vaccination, why would you suggest that they should receive it, being that it's not 100% sure that it will, in fact, eliminate or stop you from getting COVID-19? How would you tell someone or explain to someone why they should receive it?
Well, I know for me, what I suggest, this is the thing, because, again, and I think I mentioned it right at the beginning, going into flu season as well as a pandemic, how many times are you probably, like Quita, I think even mentioned, somebody sneezes, someone coughs, you're going to automatically think they have COVID. So, how many times do we all walk around possibly with a low febrile temperature? Just because you have a low febrile temperature does not necessarily mean that, and now, they're saying anything over, I think, 101, it's like, oh gosh, that's a symptom that, so I think it's more so now why it's encouraged, if you will. Obviously, it's not mandatory. That it's encouraged is because we are going into just unprecedented times, dealing with this pandemic, going into flu season, just trying to, I guess, say, not mix up, or the symptoms of the flu with the symptoms of, because so many of those symptoms are similar. I think it's saying, okay, your best possible chances if you were vaccinated could potentially say, okay, kind of rule that out in a sense. It's scary, it's scary, because again, simple cough, a sneeze or something is like, oh my gosh, even for, you may think it, I know a slight tip, I'm like, Lord Jesus, my throat itching, what's going on, so it's, this is just a recommendations that are being set forth. It's not saying that it's anything that's required. It's a recommendation because we have never had to deal with this before. You've never, flu season is flu season. Yeah. And we know, we've said it, the flu has killed more people than, we know that, but it's like now coupled with the pandemic, what do? So it's like, they're just trying to implement these different resources and saying, okay, well, if you're vaccinated, maybe that'll potentially reduce some of these side effects or these symptoms. And we can say, okay, this person was, vaccinated. These aren't necessarily flu symptoms that they're presenting with. Now we need to go here. And that's not saying that will be 100% accurate. Again, it's more of a recommendation.
Okay. That's good. That's good, because I'll have to admit, I'm actually one that always thought, that's why education is so important. I'm one that always thought that the flu vaccination causes the flu.
Yeah. Mm-hmm. And so many have, and I tell people a lot of that is a lack of, I'm not saying, providers, sometimes they don't have the time to properly educate. And I think that's what we're lacking in our healthcare system overall, because if you had known that, you would know, if your provider had shared that with you, you would know that that's not true. The flu vaccination does not cause the flu. Now, if you go and your immune system is compromised by any means and you go and you're vaccinated, can it potentially cause those symptoms to exacerbate? Absolutely. And then it's like, oh my God, I had that shot, and it wasn't until I had that shot that I started, and that's where that's where it comes from. But it doesn't cause the flu. Those are absolutely perpetuated, and that's what I'm saying. It doesn't cause it. You know what I'm saying? It and that's, again, if had my healthcare provider shared that with me and said, well, you know what, X, Y, and Z, then I would have known. And if I did, let's say, start sneezing or coughing, oh, well, no, my doctor told me that this could potentially happen, or that this was a possibility. But it's a lack of education, and a lot of that, it starts with your provider. It starts with your provider just taking that extra time to just be able to educate you, just be able to answer some of those concerns and those questions that you may have.
Okay, thanks. That's really good to know. Quita kind of touched on steaming. Quita, can you expound a little bit more on the steaming process and why that's important?
Okay, the steaming process, just basically because what happens with the steaming, it opens up your respiratory system. It helps get rid of, guess what, toxins, impurities. So, steaming is very good. Like, I steam my face every day. I have a steamer. And when I steam, what I do is I breathe in the steam. So what that is doing is clearing those nares. It's helping with the toxins and things of that nature. That's the reason why steaming is really good, because what you want to do is get rid of toxins in your body, because guess what? That is what's causing a lot of these elements. Because what happened, the coronavirus is just like any other disease process that take place. Most people don't die from the virus, they die from complications of the virus. Okay. So that is the main thing that we see, that people are dying from complications of the virus. So unfortunately, I lost my grandmother in April from the coronavirus. And my grandmother, she had underlying disease processes. She was a diabetic. She had also battled a little lung cancer as well. Now, my grandmother, she never went outside. She only went to the doctor's offices and things like that. My grandmother ended up contracting the virus from my aunt, who works for CTA, who was asymptomatic. Okay. And basically, because my grandmother was already a senior. She had diabetes, and she also had lung disease. You know, she was battling the head of two evils. So it was very difficult for her to recover from that. But one of the things was I was able to be an advocate for her while she was in the hospital, because I did refuse for her to go on the ventilator. Now, I'm going to speak very candid on the ventilator. You do not, if people are having respiratory issues, especially like the coronavirus, okay? This is a virus that is affecting the respiratory system. You do not want to put them on a closed ventilator, because guess what's happening? All you're doing is circulating that CO2 and all of that back into the body, okay? So I refuse to put, first of all, I would not put my grandmother, who was 84 years old, 82 years old, on a ventilator, already pulmonary compromised, already disease process compromised. So no, I was not gonna put her on that. So my grandmother did very well, actually. But, you know, unfortunately, her body just could not fight the virus off the way she should. So when people ask me about the ventilator, I say absolutely no. I do. That is one of my things. Absolutely no. Only way that you should be put on a ventilator if that's your absolutely last resort. But going on the ventilator is not, I've seen way more deaths on the ventilator than recovery with the coronavirus.
Wow.
I have a question, Quita. You mentioned the steam, just piggybacking off of Tamika's, because I was one, I'm gonna be honest, I was coming home boiling hot water with orange peels and you know, for real, and I was putting my head over this hot steam, about to pass out somewhere in the kitchen because it was hot, you know. Now, so you agree with that, or that process of it? You know, it's something I had heard about, you know, with the orange peels and all of that, and I was doing it. I even had my parents over there doing it, you know, over there boiling water with the orange peels and stuff, and I was doing this every single day to trying to flush out some of these toxins and these impurities. So that is something that you would recommend?
From a holistic standpoint, absolutely. From a holistic standpoint, you got to think that is more so holistic medicine opposed to traditional medicine. Holistic medicine, you're breathing in, because I was doing the and I would do it when the pandemic first hit. I was doing. I would put on a pot of water every day, and I would have turmeric and ginger and the vitamin C, and I would boil it and let it go throughout my whole house every day, all day. I know for sure that it works because, like I said, by me being very immunocompromised myself and me working in clinics and in the hospital, I should have been contracted the disease process. But however, I keep my immunity up. I keep my immunity up and I keep myself safe. So that's what I encourage. You know, sometimes you have to step outside the box with a lot of things. And that's just, you know, that's just the way it is. Because at the end of the day, you know, what I'm learning as being a provider now is really funny, because a lot of the times providers, I'm just going to say this, pharmaceutical medicine is what keeps the revenue going.
Right.
So, you know, you want to prescribe those medicines, right? But that doesn't always mean that that's the best way or the best route.
I agree.
Now, let me ask, because a lot of people do, can you all hear me?
Yes.
Okay, I switched modalities. Okay, let me ask, because a lot of people wear the cloth covered mask. Is the cloth covered mask, solely just a cloth covered mask, safe, and or does it not prevent the or create the barrier that's necessary from allowing those microbes or that virus to be able to penetrate through that or that material?
Absolutely. The cloth cover mask is pretty much to protect you. To protect you from infecting someone else. It's not protecting you 100% from any, the only way you're gonna be protected 100% is if you're wearing an N95 mask.
Yes. Agree. They say the most effective ones are starting with the N95, and then your like the blue ones with the folds in it would be next. So if you go in that order, the cloth ones are the least effective.
Yes.
In preventing. Yes.
And if a person,
The least effective. There's still a percentage. I think I want to say it was like 10% or something, 20%. But you talk about N95, that's 100%. I think the blue ones, I think it was right around 85%. But then you drop all the way down with the cloth mask. I think it was like 10 or 15%. So it's very low protection against,
Absolutely.
the virus itself or contracting it.
Yes.
So she's absolutely correct. Your mask with the filters and that's where you're going to get most of your protection from.
that if maybe they can't access it, maybe they can't afford it. Sometimes you see them with other things up under the mask to try and maybe help create that barrier. Will that work for them? So they wear like maybe tissue or a towel or something, then they put the mask on top of it, cloth mask. Will that work?
It's the same thing. It's no different. The only way that you're going to be 100% and not even 100%, the only way that you're going to be protected is if you wear the respirator mask, which is the N95, and you can wear the surgical mask as well. But again, a lot of people that's wearing the mask, you got to think you're breathing back in CO2. It's a lot of different things that's going on with this virus. Yes, we're doing it to protect ourselves. One of the good things that we need to look forward to is we should see a decline in the influenza season because masks are required now and mandated. So going into the influenza season, if everybody is wearing their mask, it should be the spread should not be as bad, okay, upon the population because they should already have on a mask. So that's one of the things that we've been looking at recently in statistics and with the CDC so the influenza season shouldn't be as bad. So we will see. But yeah, the only way to be protected is to have the respirator mask, which is the N95 mask on.
And just to piggyback really quickly off of what Cleta said, because I get a lot of questions about, I heard her a couple times mention the CO2. And I get a lot of people, they'll ask about like, CO2 intoxication or some sort of oxygen deficiency because they're wearing their mask. So I just want to be clear, when I said wearing the mask in the gym, when you're exerting and you're working out, that's very different. But when you wear your mask properly, when you wear the medical mask properly in a correct position, it does not cause CO2 intoxication, nor does it cause oxygen deficiency. So working out was a whole different perspective. That was a different scenario than just day-to-day wearing your mask, because people will say, well, and I get it. It is difficult sometimes, with breathing, especially if you have underlying medical conditions. It is, especially the N95, Lord, it's hard, to breathe effectively, but it doesn't, if it's worn correctly, it does not cause any CO2 intoxication or oxygen deficiency. It may feel like it, but it doesn't actually cause it, as you stated. So their circulation, yes, it's true, but the masks, they're effective if they're worn correctly. And that's just it.
Okay. Does anybody else have any questions? Okie doke. Well, if you do, you can.
I do actually, Tyra.
All right. Go ahead, hey,
So-
Sonia.
Hi, I'm Miss Travis. I actually have a question.
Hi,
about-
everybody.
Hello, Dr. Travis. Welcome. Thank you for joining.
I know that a lot of Latinos, the Hispanic community, they don't have the insurance and they don't have the means to go get tested, or they're afraid to get tested because of ICE and everything. Is there a way that we can give information on free clinics where they don't have any of that concern?
Yeah, well, there are a lot of free clinics right now that's out there that are doing COVID testing. So you just need to tap into where they're doing the testing at, and to be educated and to go in to get tested. Because one of the things that I have seen, I just finished dealing with a Latino family where it was 10 of them living in a home and 9 of them had COVID. It was only one person that was in the home that did not have COVID, and they were responsible for doing for everyone else in the home, like doing the grocery shopping and doing things like that, because I had to put the whole house on isolation. It took quite a while for that to clear up, because you have 9 people living in the same home that are going to keep getting reinfected, right? So it took us about a month and a half to get everyone COVID free. But the thing is education, and you cannot be afraid, because you can't run from it. You can't run from it. And unfortunately, with minorities, the minorities are the ones that's dying rapidly from the disease, because they're not getting the proper health care that they need. So, I would definitely encourage them, if you know them, to say, go get tested. Because right now, with the pandemic, nothing matters right now but controlling the disease process.
So what I can help you, I'll help you with, Sonia. I will work on that too, to help compile a list of clinics that are maybe down in that, the Pilsen area, close to the Pilsen area.
Yeah.
Okay, I'll work on that for you.
You might want to look into
Yeah.
also some of the Hispanic schools. They have their parking lot set up as a free COVID site.
Okay. I did see on social media that I don't know how true this is, but as you know, social media, people have word of mouth, they get scared. I was reading an article and a couple things that were saying that ICE was actually waiting outside those testing centers, and it kind of discourages people that are not legal from being tested.
Right.
Right.
Yeah.
So I don't know how true those are.
So they don't ask for social security numbers, and they don't ask for.
Yeah, they don't.
Only thing. I'm sorry.
No, I was just saying they don't ask for those things.
Right. So, I mean, the one over here by my house on Central near Fullerton, it's a school called, I want to say Juarez. And you can walk up and get tested, or you can drive up and get tested. And you don't have to call in for an appointment and all of that. And the only thing they ask you for is your name, your phone number, and an email address so they can send you your results. That's and your birthday. That's it.
Okay. Or thank you.
And I don't know
I think basically that's for that It's just the demographics of what they're looking for is how many people in a certain age group are being tested. That's why they're asking for age, the birth dates.
Okay, well, thank you.
You're welcome.
Very good. Any more questions? All right. Dr. Cobbs, do you have anything for us before we close that you would like to leave us with?
I do not. I think that's about it, unless someone else has any questions.
Okay. All right. And what about, I'm sorry, go ahead. Is that Dr. Travis?
Nope, I didn't have anything else.
Okay, thank you so much for joining us. Nurse Quita, did you have anything else that you wanted to close out and leave us with?
No, that's it. I just say continue to practice good health and remember health is wealth.
Absolutely, absolutely.
I do want to say one thing.
Yes, ma'am.
Please, please, and please encourage people to go out and vote.
Yes.
Definitely.
Yes. Yes.
Go out and vote.
Right.
Absolutely. That's a fist pump, Ms. Travis. Absolutely, absolutely. You heard it from Dr. Lolita Travis herself. Go out and vote. And when you do, stay protected. You can request your mail-in ballot. Now is a great time to do that because the mail system is complicated. Let's just say that. And so we want to make sure that if we choose the mail-in ballot, that you get it in enough time. That way they don't do any funny business.
Exactly. Because as our past President Obama said, get out there and get you a ballot early so that you can put it in. And if it walks there, it'll get there in time.
That's a good one. So make sure you all give your ballot enough time to walk where it gotta go. I love it. I love it. It is a pleasure. This was the first. It won't be the last. We want to make sure that we keep you guys informed. We want to help get you through this season. We want to help subside your fears, your concerns. We want to address them. We want you to feel like you have a place where you can come and really a reliable place. You heard it from the mouths of the professionals. CDC is going to be your number one and pretty much your only reliable resource to go to. You know that the information is valid. You know the information is good. It's not fake news. It's researchers and scientists who are actively involved. So if you need updates and you want to know what's going on, we want to go to the CDC. We also know that you can be reinfected. And you also know that you can have co-infection. So they have recommended that you definitely get your shots, your flu shot. That way, if you do start to have these symptoms, they're able to at least eliminate one from the other, because we know that the flu symptoms and the COVID symptoms, they mock each other. So you can help yourself by getting your flu vaccination 6 months and above. By then, if you do have problems, they can eliminate the fact that it's regular flu from it being COVID because you have been vaccinated. Also, I think another very important point, whether you think you have an underlying condition or not, go ahead and get your checkup. If you have not had an annual physical this year, or you have not had an annual physical within the last year, please, 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 and please go get your checkup, because you could have an underlying condition of which you are still asymptomatic, or rather you're not having any symptoms. You don't know you have a heart condition yet. You don't know you have diabetes. You don't know you have lupus. You don't know you have high blood pressure. You don't know. And since you don't know because you haven't been to the doctor, if in fact you do come in contact with COVID, your family is confused because they didn't know, and neither did you, that you actually did have an underlying condition. So please, please, please help yourself by going to do your physical if you have not. If you do not have insurance, of course, you can always rely on the county. Access Community Health Network is a reliable health network that utilizes your income base in order to determine a copay for you. They get grants from the state in order to see you. So we want to make sure we get our checkups so we can identify underlying conditions that we may have that we don't even know about that would make us more susceptible to COVID. So let's do that. Boost your immunity. That's a super, super important thing. Make sure you're decreasing your stress or working on that and your depression. Times are hard. Talk to someone. You hear me on the Grief Corner talk about that. Make sure you're talking to someone, because if you slip into depression, you are also weakening your immune system, and a weak immune system is compromised to COVID as well as other conditions and diseases. So please, please, please take your vitamins, do what works for you as far as a vitamin regimen. You can do holistic vitamins, and that would be great. And then wear your mask. Wear your mask. And a cloth mask is not the greatest barrier if you're going to work out. Yeah, it has been from Dr. Cobb's mouth to your ears that if you're going to work out, yes, you could do that without your mask, because the sweat is only going to wet that mask. And once it's wet, now it is susceptible to microorganisms. So do not wear your mask if you're working out. Other than that, make sure that you're socially distancing when you do so, and remain safe. Get your checkups, and continue to keep your head on a swivel and stay diligent, and make sure that you are not doing more than you need to. This is a time of reprieve. Enjoy your family and friends, keep your distance, and take care of you. We will be back sooner rather than later to touch on this topic again, do updates, address questions, again, dispel myths and things of that nature, because as a funeral home, we are a community service provider, so we want to help you in wellness to decrease death. All right. So thank you all. Thank you, Dr. Cobbs. Thank you, Nurse Quita, for being with us. Dr. Travis, thank you for taking time out of your schedule to be here. Tamika, thank you so much for joining. Sonia, thank you so much for joining here with us on today. We have recorded this, so this information will be put out there into the air. And I look forward to seeing you guys and talking to you guys on the next one around. You all have a happy holiday, and God bless you guys.
Bye. Be safe, guys. Thank you.
Bye, guys. Thank you.
Bye-bye.
Bye.